What would you do if your next breath was no longer guaranteed? Diego Santana's heart stopped beating in a Manhattan coffee shop. 23 minutes without a pulse. 23 minutes where death seemed certain. But Dr. Maya Rodriguez, a brilliant cardiologist who'd spent 7 years afraid to feel, refused to let him go. She fought for him with compressions that broke protocols and ribs. She pulled him back from death itself. And then she fell in love with the man whose heart she'd restarted. But saving his life was only the beginning. The real miracle was still to come. This is their story. The first thing you need to understand about death is that it doesn't always announce itself with drama. Sometimes it arrives quietly, in a Manhattan coffee shop on a Tuesday morning, disguised as nothing more than a moment of dizziness. Diego Santana felt it first as a flutter, his heart skipping like a stone across water. He was sitting across from his colleague, Marcus, discussing quarterly projections for their investment portfolio, when the world began to tilt. The numbers on his laptop screen blurred. The ambient noise of the cafe, espresso machines hissing, conversations humming, faded to a distant echo. "Diego, you okay, man?" Marcus's voice seemed to come from underwater. Diego opened his mouth to respond, to say that yes, he was fine, just tired from the red-eye flight from Barcelona last night. But the words never came. Instead, his chest compressed as if caught in a vice, and his heart, that faithful organ that had beaten 1.2 billion times in his 32 years, simply stopped. He didn't feel himself fall, didn't hear the screams as his chair toppled backward, his body hitting the floor with a sickening thud, didn't see Marcus fumbling for his phone, dialing 911 with trembling hands. Diego Santana, senior investment banker, marathon runner, man who'd cheated death once before in a skiing accident in the Alps, was dying in a coffee shop 3 blocks from Wall Street. And he didn't even know it. At New York City Medical Center, Dr. Maya Rodriguez was having a morning that made her question every decision that led her to cardiology. She had been awake for 36 hours, trying to stay up with espresso and stubbornly refusing to admit she was human. Even when her energy was depleted, new cases recharged her. Her dark brown hair was gathered into a messy ponytail, a sign she'd given up on looking professional after about 20 hours. Her eyes, usually sharp with intelligence and equally dark brown, were slightly red-shot, yet still incredibly focused. "Dr. Rodriguez, you need to sign Thompson's discharge papers," a nurse called out from the station. Maya waved her hand without looking up from the echocardiogram she was examining. "Give me 5 minutes. This valve replacement is showing signs—" "Maya," Dr. James Chen, the head of cardiology, came over to Maya. "Go home right now. This isn't a suggestion. I'm giving you an order as your friend." "I'm fine. You've been here for a day and a half. You're not fine. You're a liability waiting to happen." Maya finally looked up, and the expression on her face would have made lesser men retreat. She was 35, young for a senior attending cardiologist, and she'd earned that position by being brilliant, relentless, and completely unwilling to back down from anything, including her boss. "The Hernandez case. We'll still be here in 8 hours after you've slept." Chen's voice softened. "Maya, you're the best surgeon I have, but you're also the most stubborn. One of these days, that stubbornness is going to—" The overhead speaker crackled to life, cutting him off. "Trauma incoming. 32-year-old male, cardiac arrest in the field. Paramedics have been doing compressions for 8 minutes. ETA, 2 minutes. All cardiology staff to Trauma Bay 1. Maya was already moving before Chen could stop her. Her exhaustion evaporated like morning mist, replaced by the cold, crystalline focus that made her exceptional at her job. This was what she lived for, the moment between life and death, the razor's edge where her skills meant everything. She burst through the trauma bay doors, her team materializing around her like dancers who'd rehearsed this choreography 1,000 times. Nurses prepped equipment, residents stood ready with medications, the defibrillator charged with a rising whine. And then the paramedics crashed through the doors, wheeling in a man who looked too vital to be dying. Maya's clinical eye took in details in nanoseconds. Male, early 30s, athletic build, expensive suit now torn and disheveled, dark hair matted with sweat, olive skin tone suggesting Mediterranean heritage. A paramedic straddled him on the gurney, performing chest compressions with mechanical precision. "What have we got?" Maya demanded, pulling on gloves. Diego Santana, 32, collapsed in a coffee shop, witnessed cardiac arrest. Bystanders started CPR immediately. We took over at minute 4. We've shocked him 3 times. Nothing. He's been down for 10 minutes total. Asystole on the monitor. 10 minutes. Maya's mind calculated the odds automatically. Brain damage started at 4 minutes without oxygen. At 10 minutes, even if they got his heart beating again, there was a significant chance he'd wake up as someone else entirely, if he woke up at all. "Get him on the table. I need a full code cart, intubation tray, and someone page the cath lab. If we get him back, he's going straight there." Maya moved to the head of the bed, her hands already assessing his airway. "What do we know about him?" "Wallet says he's visiting from Spain, investment banker. No medical alert bracelet, no known conditions. His colleagues said he was fine 1 second, down the next." Young, healthy, no warning. This wasn't a typical heart attack. This was something else. Something that made Maya's instincts scream that they were missing a crucial piece of the puzzle. "Switch out," Maya ordered. A resident took over compressions, maintaining the rhythm that was keeping Diego's brain barely alive. "Push 1 milligram of epinephrine, and someone get me his history. Call the colleague, call his emergency contacts. I want to know everything about this man." She intubated him with practiced efficiency, securing his airway, watching his chest rise and fall with the ventilator's mechanical breaths. So much of him looked alive, the warmth still in his skin, the strength evident in his athletic frame. The way his hazel eyes, she'd noticed them when she checked his pupils, seemed like they should open any second. But his heart remained still, a flat line on the monitor that mocked every compression, every shock, every medication they pushed. "Dr. Rodriguez," her resident said quietly, "we're at 15 minutes. 15 minutes. The point where most doctors would call it, where the odds became not just bad, but astronomical, where continuing meant fighting against every statistical probability, every medical guideline." Maya looked at Diego Santana's face. This stranger had chosen the worst possible day to die in her city, in her hospital, on her shift. And a voice inside her, a voice that had nothing to do with her medical training, a voice that stubbornly refused to accept the defeat that defined her entire life, was telling her to make a decision. "We won't stop. Charge to 200. Everyone step back." "Maya!" Dr. Chen appeared at the door, watching with a worried expression, as if he'd seen her push herself too hard before. "I said move." The defibrillator delivered the shock. Diego's body lifted off the table. A brief tremor appeared on the monitor, a single, weak, uncoordinated heartbeat. Then the flat line returned. And everyone was focused on the movement of that line on the machine. But Maya had seen it, that flutter, that tiny spark of life still fighting somewhere in the damaged muscle of his heart. "He's still in there," she said, surprised by the certainty in her voice. "1 more round of epinephrine. Push it now." The medication went in. Maya placed her hands on Diego's chest, feeling for the anatomical landmarks she knew as well as her own heartbeat. 30 compressions, fast and hard. Breaking ribs if necessary, because broken ribs healed, but death was permanent. "Come on," she muttered. "Come on, Diego. Don't you dare give up." Another shock, another flatline, another round of compressions. The team was getting tired. She could see it in the way the residents' rhythm was slipping slightly, in the grim set of the nurses' faces. They'd been fighting for 20 minutes now. 20 minutes of forcing life into a body that seemed determined to slip away. "Dr. Rodriguez?" Chen's voice was gentle but firm. "It's time." Maya's hands stilled on Diego's chest. She looked at the monitors, at the flat line that had become almost hypnotic in its stillness. She looked at this man she didn't know, this stranger whose name she'd learned only because she checked his wallet for emergency contacts. Diego Santana, 32, investment banker, from Spain. Probably had a family who loved him. Maybe a girlfriend who was expecting him home tonight. Dreams and plans and a whole life that was supposed to stretch out for decades more. And in this moment, Maya Rodriguez held all of that in her hands. She looked at Chen, then back at Diego, and made a choice that would change both their lives forever. "No," she said quietly. "One more try, but I'm doing something different." Before Chen could stop her, before anyone could question the decision, Maya climbed onto the gurney, straddling Diego's still form. She locked her elbows, positioned her hands over his sternum, and began compressions that were harder, faster, more aggressive than standard protocol allowed. "Maya, what are you—" His heart's been down for 20 minutes. Standard compressions aren't generating enough pressure to perfuse his coronary arteries. I need to force blood through. She didn't stop, didn't slow, putting her entire body weight into each compression. "Get me an ultrasound. I want to see his heart in real time." The portable echo machine appeared. A nurse squeezed gel onto Diego's chest, and Maya, still doing compressions, managed to position the probe with one hand. The screen flickered to life, showing Diego's heart in grainy black and white. And there, Maya saw it, a tiny, uncoordinated quiver in the left ventricle. Not a heartbeat, not yet, but a sign that the muscle wasn't completely dead, that somewhere, deep in the tissue, cells were still trying to fire, still trying to live. "He's got ventricular activity," Maya said, her voice rising with something that might be hope. "It's unorganized, but it's there. Amiodarone, 300 milligrams IV push, now." The medication went in, an antiarrhythmic that could either restart his heart or do nothing at all. Maya kept compressing, counting aloud, her arms burning with exertion, but her rhythm never faltering. And then, on the monitor, a blip, a single, organized QRS complex. Then another. Then another. "I've got a rhythm," the nurse at the monitor shouted. Maya's hands stopped. Everyone in the trauma base seemed to hold their breath as they watched the monitor. The heartbeat was slow, irregular, weak, but it was there. Diego Santana's heart was beating on its own. "Pulse check," Maya said, her own heart hammering as she felt for his carotid artery. Under her fingers, weak but unmistakable, she felt it, the flutter of blood being pushed through his vessels. "I've got a pulse, weak but present. Get me a BP." 70/40, the nurse called out. Not good, but alive. Maya looked at Diego's face, half expecting his eyes to open, but he remained unconscious, which was probably for the best. Waking up to find himself intubated, surrounded by strangers, would be terrifying. "He needs the cath lab immediately," Maya said, climbing down from the gurney. Her legs were shaking, from exhaustion or adrenaline she couldn't tell. "The cath lab is ready," someone confirmed. As they began wheeling Diego toward the elevator, Maya caught Dr. Chen's expression, a mixture of admiration and exasperation she'd seen many times before. "You realize you just performed chest compressions that violated about 12 protocols." "I realize I just saved a man's life using chest compressions that violated about 12 protocols," Maya corrected. She pulled off her gloves, suddenly aware of how exhausted she was. "And if I hadn't, Diego Santana would be dead right now instead of—" She stopped because Diego's fingers had moved. Just a tiny twitch, barely noticeable, but Maya had been watching for signs of neurological function. "He's responding to stimuli," she said, moving closer. "Diego, can you hear me?" His eyelids fluttered. For just a second, those hazel eyes opened, unfocused and confused, before closing again. But it was enough. Enough to tell Maya that she'd been right to keep fighting. That somewhere, beneath the unconsciousness and the intubation tube and the medications, Diego Santana was still in there. Still alive. Still fighting. The elevator doors closed and took Diego to the catheterization lab to investigate the cause of his cardiac arrest. Maya stood in the trauma room, suddenly alone among the people and equipment, surrounded by the remnants of the emergency. Intravenous material packaging, EKG papers documenting his death and revival, the smell of emergency medicine. 23 minutes. That was how long Diego Santana had been clinically dead. And yet somehow he had come back. Fate seemed still to want him to live. But Maya knew this was only the beginning. The real battle, the one to ensure not just his survival, but his full recovery, was just beginning. And this battle would test everything she thought she knew about the fine line between medicine, life, and the struggle to resist giving up. She headed for the cath lab, knowing sleep would have to wait a little longer, because Diego Santana had just become her patient, and Maya Rodriguez didn't lose patience. Not today. Not ever. Maya felt an uncomfortable warmth in her chest. She realized she was entering the dangerous territory of emotional attachment. With a slight flutter, she said, "It wouldn't have mattered if it was you or someone else. I was just doing my job." For 23 minutes, Diego's eyes, despite his weakened state, held a sharp gaze. He was impressed by the doctor who had brought him back to life. Marcus said, "He was in the waiting room. He said the other doctors wanted to give up, but you kept going. Standard protocol." "Thank you." Diego's hand found Maya's again and squeezed it gently, but their chemistries seemed to mix in that moment. "I don't care about the protocol. Thank you for saving my life." Maya pulled her hand back, suddenly needing distance. "You should rest. Your heart is still damaged, broken, beyond repair." "Recovering," Maya corrected firmly. "We found the cause of your cardiac arrest, coronary artery spasms. We can manage it with medication, but you'll need to make lifestyle changes, reduce stress." "I died today." Diego's voice was quiet but intense. "I felt it, everything going dark, and then light and pain, and your voice telling me not to give up. You brought me back. Why?" "Because that's what I do. I'm a doctor." "No." Diego shook his head slightly. "There was something else. I could hear it in your voice, like you were fighting for more than just another patient." Maya's jaw tightened. This man, this stranger who'd been unconscious throughout his entire resuscitation, was seeing too much, understanding too much. "You were hallucinating. Lack of oxygen to the brain can cause—" "I know what I heard, and I know what I felt. Someone who cared whether I lived or died." The silence stretched between them, heavy with implications that Maya refused to acknowledge. Finally, she said, "You need to rest. I'll be back to check on you in a few hours." She turned to leave, but Diego's voice stopped her at the door. "Dr. Rodriguez? Maya?" She didn't turn around. "Yes?" "I'm going to figure out why you're so afraid of being thanked. Why you run from connection like it's a disease." I'm very good at reading people. It's what makes me successful at my job. And you, doctor, are terrified." Maya's hand clenched on the doorframe. Without looking back, she said, "Get some rest, Mr. Santana. You're going to need your strength for the long recovery ahead." She left before he could respond, her heart beating faster than it had any right to. In the hallway, she leaned against the wall and closed her eyes, trying to regain the composure that had slipped in Diego's presence. He was just a patient, a particularly perceptive patient, but still just a patient. In a few days, he'd be stable enough to transfer to a regular room. In a few weeks, he'd be discharged, and Maya would go back to her carefully controlled life of saving strangers and feeling nothing. That was the plan. That was always the plan. But as Maya walked back to her office, Maya couldn't shake the image of Diego's hazel eyes looking at her like he could see straight through the fortress she'd spent 7 years building. And worse, much worse, she couldn't shake the realization that for the first time in 7 years, she'd been afraid to lose a patient not because of professional pride, but because something about Diego Santana had reached through her defenses and reminded her that she was still human, still capable of caring, still capable of being hurt. The fortress, Maya realized with a sinking feeling, had just sustained its first crack, and Diego Santana, the man she'd pulled back from death, was about to teach her that some battles weren't worth fighting alone. The cardiac catheterization lab was Maya Rodriguez's cathedral, a sterile temple of steel and glass where miracles happened under fluoroscopic guidance. She stood now in the control room, scrubbed and gowned, watching Diego Santana's heart on multiple monitors while her hands guided a catheter through his femoral artery with the precision of a watchmaker. Advancing past the iliac bifurcation, she narrated for the benefit of the residents observing from behind the lead glass. Heart rates holding at 62, blood pressure 90/55. He's stable, but barely. On the screen, Diego's coronary arteries appeared as dark rivers against the lighter tissue, illuminated by contrast dye that Maya had injected moments before. She was searching for the usual suspects: blockages, clots, structural abnormalities that could explain a cardiac arrest in an otherwise healthy 32-year-old man. "Left main coronary artery looks clean," she murmured. Advancing to the LAD, no stenosis. Circumflex is clear. Right coronary. She paused, her eyes narrowing at the screen. Wait. There. Dr. Chen, who'd insisted on observing the procedure, leaned forward. "What am I looking at?" "Coronary artery spasm. See that narrowing? That's not a blockage, that's the artery itself constricting." Maya's mind was already racing through the implications. Prince metal angina. Rare in someone his age, but it fits. The spasm cuts off blood flow to the heart muscle, triggers an arrhythmia, and if it's severe enough, causes the heart to stop entirely, Chen finished. But Prince metal is usually triggered by something: stress, drugs, underlying conditions, which we won't know until he wakes up. Maya withdrew the catheter carefully, her movements economical and precise. "I'm putting him on calcium channel blockers and nitrates. If we can prevent the spasms, we can keep his heart beating. And if we can't?" Maya's hands didn't falter, but something flickered across her face, a shadow of the fear she refused to acknowledge. "Then we'll deal with that when it happens." 3 hours later, Maya finally arrived at her office. It was a small, cluttered room. It reflected the chaos of someone more preoccupied with saving lives than organizing paperwork. She collapsed into her chair, her body suddenly remembering it hadn't slept in 40 hours, and it couldn't carry her anymore. On her desk sat a photograph she tried not to look at too often. Herself at 28, wearing a white coat that still looked new and clean, full of dreams and goals, standing next to Dr. Robert Martinez, her mentor, the man who taught her everything about cardiology but didn't teach her how to survive when the person on the table was someone you loved. Maya picked up the photo, tracing the edges of Robert's face with her thumb. Every detail rekindled her longing for him. Robert had died 7 years ago, sudden cardiac arrest during his morning run. It was truly ironic that a cardiologist had died of a heart attack. The autopsy revealed an undiagnosed genetic disorder, one that had been hidden in his DNA for 53 years and had finally surfaced. She'd been the one to find him, had performed CPR on the hospital lawn while waiting for help that came too late, had felt his heart stop beating beneath her hands, and known with terrible certainty that all her training meant nothing when it mattered most. That was the day Maya Rodriguez had built her fortress, had decided that caring too much was a liability she couldn't afford, that the only way to survive in this profession was to maintain distance, to see patients as puzzles to solve rather than people to save. It had worked for 7 years. She'd become one of the best cardiologists on the East Coast, known for her brilliant diagnostic skills and her complete lack of bedside manner. Nurses called her Ice Queen behind her back. Patients complained that she was cold, clinical, detached. But they were alive, and that was all that mattered. Maya set down the photograph and pulled up Diego Santana's file on her computer. The information his colleague Marcus had provided was sparse but telling. Diego was in New York for a week of meetings. He'd flown in from Barcelona the night before. No history of heart problems, no medications, no drug use. He was a runner, had completed 3 marathons in the past 2 years. Nothing that explained why a healthy man's heart had simply stopped beating. Maya scrolled through his social media profiles, telling herself she was looking for medical clues. Diego's Instagram showed a life of enviable adventure. Photos from Ibiza, the Swiss Alps, a vineyard in Tuscany. Always smiling, always surrounded by friends, always radiating the kind of easy confidence that came from having never faced real hardship. Until today. Her phone buzzed. A text from the ICU. Patient in bed 7 showing signs of consciousness. Vitals stable. Thought you'd want to know. Maya was out of her chair before she'd consciously decided to move. The ICU was 2 floors down, and she took the stairs because waiting for the elevator felt impossible. When she pushed through the double doors of the cardiac intensive care unit, she found Diego's room already occupied by 2 nurses checking his vitals. He opened his eyes about 10 minutes ago, the older nurse reported. Seems agitated. We haven't removed the breathing tube yet. Wanted you to assess him first. Maya approached the bed slowly, her clinical eye taking in every detail. Diego's color was better, no longer the gray pallor of death, but a healthier olive tone. His heart monitor showed a rhythm that was stronger, more organized. But his eyes, those hazel eyes that she'd seen only briefly in the trauma bay, were open now and filled with confused panic. Diego, Maya said, keeping her voice calm and authoritative. My name is Dr. Rodriguez. You're in the hospital. You had a cardiac arrest, but you're alive now. You have a breathing tube in your throat, which I know is uncomfortable. I'm going to ask you some questions. If you understand me, blink twice. He blinked twice, his gaze locking onto her face with an intensity that made her uncomfortable. Good. Can you squeeze my hand? Maya extended her hand and Diego's fingers closed around her with surprising strength. Excellent. Your neurological function appears intact. That's very good news. She began the standard assessment, checking his pupils, his motor responses, his ability to follow commands. All normal. Miraculous, really, after 23 minutes without a pulse. Someone like Diego should have woken up with brain damage if he woke up at all. But here he was, alert and aware and very much alive. I'm going to remove the breathing tube now, Maya said. It's going to be uncomfortable, but it'll be over quickly. On 3. 1, 2. She pulled the tube before she reached 3, a trick Robert had taught her, because anticipation made everything worse. Diego coughed violently, his face contorting with discomfort, but then he was breathing on his own, and Maya could see the relief in his eyes. Water, he rasped, his voice rough from the intubation. Patricia handed Maya a cup with a straw, and Maya held it while Diego sipped carefully. The intimacy of the gesture, helping him drink like a child, felt strange. She wasn't used to this kind of caregiving, wasn't comfortable with it. Better? Asked Maya, pulling back slightly. Diego nodded, then said in accented English, "What happened?" "Your heart stopped. We don't know exactly why yet, but we're running tests. How do you feel?" As if a truck had hit him. He managed a faint smile that stripped his face of his handsomeness, rendering it almost devastating. "And I'm grateful. Someone told me that they saved my life, that they didn't give up, that they fought for me." Diego Santana had always believed that life-threatening experiences brought clarity to people, helping them suddenly understand what truly mattered in life. The truths he believed in were often impossible dreams for others. However, 3 days after suffering a heart attack, lying in his hospital bed, watching the patterns the sun drew on the sterile white walls in the early morning hours, the only thing he felt was confusion. And strangely, impossibly, he was alive. "Your heart rate is rising again," Maya said, entering his room at exactly 6:47 a.m. as she did every morning, without preamble, using only the phrases she had established for her job. She walked toward the monitor, her dark eyes scanning the numbers with the focused intensity he had come to recognize. "Do you have chest pain, shortness of breath? How do you feel?" "Good morning to you too, Dr. Rodriguez," Diego replied, in Spanish-accented English that had grown stronger as the intubation damage healed. "And no, no pain. My heart just responds when you enter the room." Maya's hand paused on her chart. "That's not medically." "It's true," Diego interrupted gently. "Every morning at 6:47 a.m., my heart rate goes from 72 to 85. You can check the logs." Maya did check. Her finger traced back through 3 days of vitals, and there it was, an inexplicable spike at precisely the time of her morning rounds. She frowned. "That's unusual, or perfectly logical." Diego shifted in his bed, wincing slightly. His chest was still sore from the compressions that had broken 2 ribs. "My body recognizes the person who saved my life. Maybe it's grateful." "Hearts don't feel gratitude, Mr. Santana. They're muscles that pump blood." "Then why did mine stop beating until you told it not to?" Diego's hazel eyes held hers with unsettling directness. "The nurses told me, said you were on it, literally on top of me, doing compressions that went beyond protocol, putting your entire body into forcing my heart to remember how to beat." Maya's jaw tightened. "The nurses talk too much." "The nurses care about their patients. Maybe you should try it sometime." The words hung between them. Not quite an accusation, but close. Maya should have left, should have maintained the professional distance that had served her so well for 7 years. Instead, she found herself pulling up a chair and sitting down, which she never did during rounds. "You don't know anything about me," she said quietly. "I know you've been here every day at 6:47 a.m., even though you're not the attending on call. I know you check my vitals personally instead of relying on the nurse's reports. I know you adjusted my medication 3 times yesterday because you noticed a pattern in my heart rhythm that the monitors didn't flag." Diego's voice was gentle but persistent. "I know you care, Dr. Rodriguez, even though you're desperately trying to pretend you don't." Maya looked away, focusing on the window where New York was waking up. Cars honking, people rushing to work, life continuing in its relentless forward motion. "I lost someone once, someone I cared about. Another doctor, my mentor." It was the first personal thing she'd shared with a patient in 7 years. The words felt rusty, uncomfortable, like using muscles that had atrophied from disuse. "Cardiac arrest?" Diego asked softly. "How did you—" "Diego, because you fight for your cardiac patients like you're fighting against death itself, like it's personal." Diego shifted again, this time reaching for the water cup on his bedside table. Maya handed it to him automatically, and their fingers brushed. A brief contact that sent an unexpected jolt through her. I'm sorry for your loss. It was a long time ago. 7 years, Diego said. The nurses mentioned that too, said you changed after Dr. Martinez died, became the best cardiologist in the hospital, but also the coldest. Maya's head snapped up. They had no right. They're worried about you, the way I'm starting to be. Diego set down the water cup and looked at her with an expression that was far too understanding. Maya, can I call you Maya, or do you need the armor of Dr. Rodriguez? Dr. Rodriguez is fine. Maya, it is then. Diego smiled slightly at her exasperated expression. I saved your life. That creates a bond whether you like it or not. And I'm Spanish. We don't do emotional distance. We feel things. We talk about them. We live. You almost died 3 days ago. You should be resting, not psychoanalyzing your doctor. I did die 3 days ago, for 23 minutes. Do you know what that does to a person? It makes you realize that time is the only currency that matters, and I don't want to waste another second pretending. Pretending I'm not grateful, pretending I don't want to know the woman who breathed life back into my dead heart. Maya stood abruptly, the chair scraping against the floor. Mr. Santana, Diego, Mr. Santana, Maya repeated firmly. You're experiencing a phenomenon common to patients who've survived near-death experiences. It's called, don't. Diego's voice was sharp now. Don't make what I'm feeling into a syndrome or a side effect. I'm not in love with you, if that's what you're worried about. I don't even know you, but I want to. And I think maybe you want to know me too. That's why your hands are shaking. Maya looked down and realized he was right. Her hands, her surgeon's hands, famous for their steadiness, were trembling slightly. She clenched them into fists. I need to finish my rounds. She headed for the door. Maya. She stopped, but didn't turn around. Thank you, Diego said softly, for everything. And I'm sorry if I'm making you uncomfortable, but I spent 23 minutes dead, and it taught me that discomfort is better than numbness, that feeling anything, even fear, is a gift. Maya left without responding, but his words followed her down the hallway like ghosts. The decision was made that afternoon in Maya's office by Dr. Chen, with the gravity of a judge delivering a verdict. The genetic panel results are in, he said, sliding a folder across the desk. Diego Santana has a calcium channel mutation, specifically a variant in the CACNA1C gene. This causes unpredictable coronary artery spasms that could lead to sudden cardiac death. Maya opened the folder with trembling hands and equal excitement, her eyes scanning the results with growing fear. This mutation, how controllable is it? Is it possible to manage it? With medication and lifestyle changes, he could lead a relatively normal life. But Maya, Chen's expression was serious. The mutation is progressive. We need to take this seriously. The spasms will get worse over time, more frequent, more severe, and eventually, the drugs will be insufficient, Maya finished. Her voice was hollow. How much time do we have? Impossible to say. Could be 10 years, could be 10 months. Every case is different. Maya stared at the genetic report, at the cold clinical data that spelled out Diego's future in nucleotides and probabilities. She thought about his smile this morning, the way he'd talked about time being the only currency that mattered. The cruel irony of it. A man who'd just learned to value every moment, being told those moments were numbered. Who's going to tell him? Asked Maya. You're his primary cardiologist. It should come from you. I can't. The words escaped before Maya could stop them. Frank, Maya, you delivered bad news hundreds of times. Why is this different? Because he makes my hands shake. Because he sees through my fortress like it's made of glass. Because for the first time in 7 years, I care about a patient beyond their medical outcome, and I don't know how to protect myself from that. Instead, she said, I'll tell him. This afternoon, Maya stood outside Diego's room for a full minute before entering, the genetic report clutched in her hand like evidence of a crime. Through the window, she could see him sitting up in bed, laughing at something on his phone. He looked healthy, vibrant, alive, not like someone whose genetic code was slowly killing him. When she entered, his smile faded immediately. "That's not your usual expression. What's wrong?" "We need to talk about your test results," Maya said, pulling up the chair she'd sworn she wouldn't use again. "That sounds ominous." Diego set down his phone, his full attention on her now. "Am I dying? Again?" "You have a genetic mutation, CACNA1C variant. It's what caused your cardiac arrest, and it's progressive." Maya watched Diego process the information, saw the moment comprehension dawned in his hazel eyes. But instead of fear or anger, she saw something unexpected: calm acceptance. "How long?" he asked simply. "Years, possibly, but the condition will worsen over time. The spasms will become more frequent despite medication." Diego nodded slowly, then surprised her by smiling. A real smile, not forced or brave, but genuine. "Then I guess I better make the most of whatever time I have." "You're not upset?" Maya asked, confused. "I was dead 3 days ago. Anything beyond that is a gift." Diego reached for her hand, and this time she didn't pull away. "Besides, I have an excellent cardiologist. If anyone can keep my broken heart beating, it's you." Maya felt something crack inside her chest, a small fissure in the fortress she'd built carefully. "I can't make promises. This mutation—" "I'm not asking for promises. I'm asking you to keep fighting for me the way you did in that trauma bay, to not give up even when the odds are impossible." His grip on her hand tightened. "Can you do that?" Maya looked at their joined hands, doctor and patient, professional and personal, all the boundaries she'd sworn to maintain blurring into something new, something terrifying, something that felt dangerously like hope. "Yes," Maya heard herself say, "I can do that." And with that single word, Maya Rodriguez admitted what she'd been fighting for 3 days. Diego Santana had become more than just another patient. He'd become someone worth fighting for, someone worth risking her carefully constructed walls for, someone who might just teach her that feeling everything, even fear, even loss, even love, was better than feeling nothing at all. The verdict was in, and whether it led to triumph or tragedy, Maya knew she was no longer facing it alone. The darkness came on a Thursday night, 12 days after Diego's initial cardiac arrest. Maya was in her apartment for the first time in 3 days, a small, minimalist space in Brooklyn that felt more like a hotel room than a home. She just stepped out of the shower when her phone rang with the ringtone she'd assigned to the hospital. Urgent, insistent, impossible to ignore. "Dr. Rodriguez," the voice belonged to Patricia, the ICU nurse. "Diego Santana is having another episode. Heart rate's dropping, blood pressure's bottoming out. We need you here now." Maya was already moving, pulling on clothes with one hand while cradling the phone with the other. What triggered it? Did he have chest pain? Warning symptoms? Nothing. He was fine 1 minute, laughing with his friend Marcus, who was visiting. Then he just collapsed. "Dr. Morrison's with him now, but Maya," Patricia's voice cracked slightly, "it doesn't look good." Maya made it from Brooklyn to Manhattan in 17 minutes, breaking at least 6 traffic laws. She burst through the ICU doors to find organized chaos. Diego's room filled with medical staff, the crash cart positioned by his bed, monitors screaming their alarm symphony. "Dr. Morrison," the attending on call, looked up as Maya entered. "Rodriguez, good. He's in V-fib. We've shocked him twice. No response." Blood pressure's non-existent. I'm about to start compressions. Maya pushed through to the bedside and felt her heart stop at what she saw. Diego's face was gray again, that terrible color she'd seen 12 days ago. His eyes were closed, his body limp. The monitor showed the chaotic squiggle of ventricular fibrillation, his heart quivering uselessly instead of pumping blood. "Let me," Maya said, positioning her hands on his chest. She began compressions with the aggressive force she'd used before, the technique that had worked once but might not work again. "Charge to 200. Everyone clear." The shock delivered. Diego's body arched. The monitor showed a brief normal rhythm, 3 beats, 4, before degenerating back into V-fib. "Again," Maya ordered, 300 joules. Another shock, another brief moment of hope, followed by flatline despair. Maya's arms were already burning, but she didn't slow her compressions. Couldn't slow them, because this was Diego. Diego who'd made her laugh yesterday with his terrible hospital cafeteria food reviews, who'd learned the names of every nurse on the floor, who'd looked at her this morning and said, "You know, I think I'm going to live, really live, and I want you to teach me how." "Epinephrine's in," Morrison reported. "Maya, we're at 15 minutes. His prognosis is better than it was 12 days ago because we know what we're dealing with," Maya interrupted, not stopping her compressions. "The calcium channel blockers aren't working. The mutation is progressing faster than we anticipated, but that doesn't mean we give up." She locked eyes with Morrison over Diego's body. "Get me Dr. Hassan from the transplant team now." Morrison's eyebrows shot up. "You're thinking transplant? Maya, he's not even stable enough to—" "Then we make him stable. Push another round of amiodarone, and someone page cardiothoracic surgery. If we can't get his heart beating normally, we're putting him on ECMO until we figure out what comes next." ECMO, extracorporeal membrane oxygenation, a machine that would essentially take over the function of Diego's heart and lungs, keeping him alive while they searched for a more permanent solution. It was a desperate measure, fraught with complications and no guarantee of success. But it was better than watching him die. The next hour was a blur of controlled medical warfare. They shocked Diego 3 more times before finally achieving a rhythm stable enough to cannulate him for ECMO. Maya's hands never shook as she inserted the massive catheters into his femoral vessels, connecting him to the machine that would keep him alive. But inside, something was breaking. The careful control she'd maintained for 7 years, fracturing under the weight of fear she couldn't suppress. By 2 a.m., Diego was stable in the most technical sense, alive, oxygenated, but unconscious and completely dependent on machines. Maya stood by his bedside, watching the ECMO pump cycle his blood through its circuits, doing the work his heart could no longer manage. "You should go home," Dr. Chen said from the doorway. He'd arrived an hour ago, summoned by the crisis. "There's nothing more you can do tonight." "I'm staying." "Maya, I said I'm staying." Maya's voice was raw. "I promised him I wouldn't give up, that I'd keep fighting, and I can't do that from home." Chen was quiet for a moment. Then, "You care about this one." It wasn't a question. Maya didn't bother denying it. "He's my patient. He's more than that. I've watched you for 3 years, seen you save hundreds of patients, but I've never seen you look at one the way you look at him." Maya's hands clenched on the bed rail. "What am I supposed to do, James? Let him die to protect myself? Maintain professional distance while his heart fails?" "Don't." Maya's voice was sharp. "Don't tell me some battles can't be won. Not about him. Not tonight." Chen sighed, but didn't argue. "I'll be in my office if you need me." After he left, Maya pulled a chair and sat beside Diego's bed. In the dim light of the monitors, she studied his face, so peaceful in unconsciousness, as if he were merely sleeping. The ECMO machine hummed its mechanical lullaby, and Maya found herself talking to him even though she knew he couldn't hear. "You were right," she said softly. "I am terrified. Terrified of caring about you. Terrified of losing you the way I lost Robert. Terrified that if I let you in, if I let myself feel something for you beyond professional obligation, it'll destroy me when you're gone." She reached out and took his hand, limp and warm, sustained by artificial circulation. "But I'm more terrified of not trying, of playing it safe, and wondering the rest of my life if I could have saved you if I'd just been brave enough to fight harder." The machines beeped their response. Diego's chest rose and fell with mechanical precision, but there was no flutter of eyelids, no squeeze of fingers, just the awful silence of a body kept alive by technology. Maya's phone buzzed. A text from Marcus, Diego's colleague who'd become a fixture in the waiting room. Is he going to make it? Maya stared at the message, her fingers hovering over the keyboard. The honest answer was, "I don't know." The optimistic answer was, "We're doing everything we can." The answer she wanted to give was, "Yes, because I can't survive in a world where he doesn't." Instead, she typed, "He's stable, on life support. We're exploring all options." Marcus's reply came immediately. "He told me yesterday that if anything happened, I should give you something. Check his belongings. Bedside table drawer." Maya opened the drawer with trembling hands. Inside, she found Diego's phone, wallet, and a sealed envelope with her name written on it in his distinctive handwriting. She opened it with the irrational fear that it was a goodbye letter, but instead, it was something else entirely. "Maya, if you're reading this, I'm either unconscious or dead, and either way, I'm trusting you to make decisions about my care. But before you do, I need you to know something. I lied when I said I wasn't in love with you. I am, or I'm falling, or I would be if you gave me the chance. I know it's too fast, too intense, too complicated. I know you're going to tell yourself it's just transference, just gratitude, just the psychological aftermath of near death. But it's not. It's you, your brilliance, your dedication, the way you fight for people even when you pretend not to care, the way you looked at me this morning like you were seeing me, really seeing me for the first time. So here's what I'm asking. Don't let fear make your decisions. Don't let the possibility of loss stop you from the certainty of now. Fight for me the way you fought in that trauma bay, like my life is worth the risk of your heart breaking. And if I don't make it, know that the 12 days I've spent knowing you have been worth every moment of the 32 years that came before. Diego." Maya read the letter 3 times, tears streaming down her face, the first tears she'd cried since Robert's funeral 7 years ago. Her carefully constructed fortress wasn't just cracking anymore, it was shattering, and she was terrified of what lay on the other side. But Diego was right. Fear had guided her for too long. Fear had kept her safe, but also kept her alone. Fear had protected her heart by ensuring she had nothing worth protecting. Maya folded the letter carefully and placed it back in the envelope. Then she stood, wiped her tears, and walked to the nurse's station with renewed purpose. "I need Dr. Hassan's cell phone number and contact information for every heart transplant center on the East Coast. Diego Santana is going on the transplant list tonight, and while we're waiting for a donor, I'm going to keep him alive through sheer stubbornness if necessary." Patricia smiled, the first smile she'd seen from her in hours. "Welcome back, Dr. Rodriguez." Welcome back? The Maya we all know, the one who doesn't accept defeat. We were worried you'd given up. "I don't give up," Maya said, her voice steady again. "Not on patience. and especially not on Diego. She returned to his bedside, took his hand, and made a promise she wasn't sure she could keep, but knew she had to make anyway. "I'm fighting for you," she whispered, "even if it breaks me, even if I lose. You're worth the risk, Diego Santana. You're worth everything." The machines hummed their agreement, and somewhere in the darkness, Maya thought she felt the slightest pressure. Diego's fingers squeezing her is so faint it might have been imagination. But it was enough. Enough to hold on to. Enough to hope. Enough to keep fighting. The spark came from the most unexpected place, a pediatric cardiology conference that Maya almost didn't attend. It was day 4 of Diego's ECMO support. 4 days of watching machines do the work his heart couldn't. 4 days of consulting with transplant teams, reviewing donor lists, and facing the grim reality that Diego's rare blood type and deteriorating condition made him a difficult candidate for transplant. 4 days of Maya living at the hospital, surviving on coffee and the stubborn refusal to accept defeat. "You need to leave this building," Dr. Chen said, finding her in the ICU at 6 a.m. on Saturday morning. "There's a cardiology conference at Columbia today. New research on genetic cardiac conditions. You should go." "I can't leave Diego." "Diego is stable as someone on ECMO can be. And you're no good to him if you collapse from exhaustion." Chen's voice softened. "Maya, you've been here for 96 hours straight. If you don't take a break, I'm going to have you admitted as a patient." Maya wanted to argue, but she knew Chen was right. She was running on fumes, making decisions in a fog of exhaustion that could cost Diego his life. "4 hours. I'll go to the morning sessions and come back. Take 6. Eat something that isn't from a vending machine, maybe even shower." Maya did shower in the doctor's lounge with hospital soap that smelled like antiseptic. She changed into spare scrubs she kept in her locker and took a taxi to Columbia, arriving just as the keynote speaker was being introduced. Dr. Yuki Tanaka, visiting from Tokyo University Hospital. Maya had read her work, groundbreaking research on genetic cardiac mutations, but she'd never heard her speak. What happened in the next hour would change everything. Dr. Tanaka's presentation focused on a revolutionary approach to treating progressive calcium channel mutations, the exact mutation Diego had. Instead of managing symptoms with medication, her team had developed a gene therapy that could potentially correct the mutation at its source. Maya sat forward in her seat, her exhaustion forgotten, as Dr. Tanaka displayed case studies. A 19-year-old girl in Tokyo who'd been in heart failure, a 42-year-old man who'd survived 3 cardiac arrests, both treated with the experimental gene therapy, both now living normal lives with fully functioning hearts. The therapy works by delivering a corrected version of the CACNA1C gene directly to cardiac muscle cells using a modified adeno-associated virus. The corrected gene then produces functional calcium channels, preventing arterial spasms that cause cardiac arrest. Maya's hand shot up before she could think better of it. "What's the success rate, and has it been tested on patients requiring ECMO support?" Dr. Tanaka's eyes found Maya in the crowd. 73%. And yes, we've treated 2 patients on ECMO. Both survived and were weaned off mechanical support within 2 weeks. 73%. Not perfect, but infinitely better than Diego's current odds of surviving to transplant. Maya's mind was already racing through logistics, how to get the therapy, how to get approval, how to convince the hospital ethics board to allow an experimental treatment. After the presentation, Maya pushed through the crowd to reach Dr. Tanaka. "Dr. Tanaka, I'm Dr. Maya Rodriguez from New York City Medical Center. I have a patient, 32 years old, CACNA1C mutation, currently on ECMO after his second cardiac arrest in 2 weeks. He's not a good transplant candidate. Your therapy might be his only chance. Dr. Tanaka studied Maya with sharp, intelligent eyes. This patient means something to you, beyond medical interest. It wasn't a question, but Maya answered anyway. Yes. The therapy is still experimental, not approved in the United States. Getting permission would require navigating significant regulatory hurdles. I don't care about hurdles. I care about saving his life. Maya pulled out her phone, showing Dr. Tanaka Diego's file, his genetic panel, his deteriorating cardiac function. He's running out of time. If there's any way. There might be. Dr. Tanaka's expression shifted to something like sympathy. I'm presenting these results to the FDA next month as part of our application for expanded access trials. But in cases of life-threatening emergency, there's a compassionate use pathway. If you can get your hospital's ethics board to approve, and if your patient consents, or his medical proxy does, I could provide the therapy under emergency investigational protocol. Maya's heart was pounding. What would you need from me? Complete medical records, evidence that all conventional treatments have failed or are unlikely to succeed, a compelling case that the potential benefits outweigh the risks. Dr. Tanaka pulled out her own phone. And you'll need to move fast. The therapy works best before cardiac muscle sustains irreversible damage. How long has your patient been on ECMO? 4 days. Then you perhaps have a week, maybe 2. After that, even if the gene therapy corrects the mutation, his heart may be too damaged to recover. Dr. Tanaka handed Maya a business card. Send me everything by Monday. I'll review it and let you know if I think he's a candidate. But Dr. Rodriguez, her expression grew serious. This therapy is not a guarantee. It's a chance, nothing more. A chance is more than he has right now, Maya said. Thank you. Thank you for even considering. Thank your patient, Dr. Tanaka interrupted gently. If he's inspired this kind of dedication in you, he must be remarkable. Maya thought about Diego's letter still folded in her pocket, about his smile, his terrible jokes, the way he'd looked at her and seen through every defense she'd built. He is, she said softly. He really is. Maya burst back into the ICU 4 hours later, her exhaustion replaced by manic energy. She found Dr. Chen reviewing charts at the nurse's station. I found something, she said without preamble. Gene therapy, experimental but promising, 73% success rate in trials. I need to call an emergency ethics board meeting. Chen's eyebrows rose. Slow down. What are you talking about? Maya pulled up Dr. Tanaka's presentation on her phone, talking rapidly as she showed him the data. The therapy corrects the CACNA1C mutation at the genetic level. It's been successful in patients on ECMO. It could save Diego's life, James. Actually save it, not just buy time. And the risks? Immune reaction to the viral vector, possible myocarditis, arrhythmias. In worst-case scenarios, Maya's voice faltered slightly. It could accelerate his cardiac failure instead of fixing it. So you're asking permission to try an experimental therapy that might kill him faster than his current condition. I'm asking permission to give him a fighting chance instead of just waiting for him to die or for a transplant that might never come. Maya met Chen's eyes. You asked me once what makes this patient different. This is it. I believe in this therapy. I believe it can work, and I believe Diego deserves the chance to try. Chen was quiet for a long moment. Then, you'll need the ethics board's approval, medical proxy consent, and you'll need to present a case so compelling that they can't say no. I can do that. Maya, Chen's voice dropped. If this goes wrong, it's not just Diego's life on the line. It's your career, your medical license, everything you've built. Are you prepared for that? Maya thought about the question for exactly 3 seconds. Then, yes. Because somewhere between the trauma bay and this moment, Diego Santana had stopped being just a patient and become something else entirely, someone worth risking everything for, someone who taught her that feeling afraid was better than feeling nothing at all. I'll schedule the ethics board meeting for Monday morning, Chen said. You have 48 hours to build your case. Make it count. Maya spent the next 2 days living in the medical library, compiling every piece of research she could find on gene therapy for cardiac mutations. She contacted Dr. Tanaka 6 times, getting clarification on protocols, success rates, potential complications. She reviewed Diego's complete medical history, building a timeline that showed conventional treatment wasn't working. And on Sunday night, she did something she'd never done before. She sat beside Diego's unconscious form and asked him for his opinion. I found something, she told him, even though the sedatives meant he couldn't hear. A therapy that might fix your heart, actually fix it, not just manage it. But it's risky, Diego, really risky. It could work, or it could, her voice broke slightly, it could make things worse. She squeezed his hand, felt the warmth sustained by machines. I need to know what you'd want. If you were awake, if you could decide, would you want me to try? Would you want the chance even knowing you might not survive it? The machines beeped their steady rhythm. Diego's chest rose and fell, but there was no answer, no sign, nothing to guide her except the letter he'd written, the one that told her not to let fear make her decisions. I think you'd say yes, Maya whispered. I think you'd say that living with hope is better than dying with certainty, that taking the risk is what makes us human. She stood, her decision made. Tomorrow she'd face the ethics board. She'd make her case with every ounce of passion and precision she possessed. She'd fight for Diego's right to try, for his chance at a real life instead of a slow death. And if she failed, if the board said no, if the therapy didn't work, if Diego died despite everything, at least she'd know she'd tried, that she'd chosen hope over fear, that she'd let herself care about someone even knowing it might destroy her. The fortress was gone now, demolished completely, and in its place was something Maya had forgotten how to feel. Vulnerability. Raw, terrifying, beautiful vulnerability. She was falling in love with Diego Santana. Maybe had been since the moment she'd refused to stop his compressions, since she'd seen that flicker of life in his heart and decided to fight for it. And tomorrow, she'd fight for him again, not as a doctor maintaining professional distance, but as a woman who'd learned that some people were worth breaking for. Maya pulled out her phone and sent a text to Marcus. Tell Diego's family to be here Monday at 9 a.m. Ethics board meeting. We're trying something new. Marcus's response came immediately. His mother is flying in from Barcelona tonight. She'll be there. And Maya, thank you for not giving up on him. Maya looked at Diego's peaceful face one more time, then headed to her office to finalize her presentation. She had 16 hours to prepare the case of her life. 16 hours to convince a room of doctors that hope was worth the risk. 16 hours to save the man who saved her by teaching her how to feel again. The spark had been lit. Now all that remained was to see if it could ignite a miracle, or if it would burn everything to the ground. The ethics board conference room felt like a courtroom. Maya stood at the head of the table, her presentation loaded on the screen behind her, facing 7 physicians whose decision would determine whether Diego lived or died. Dr. Elizabeth Warren, the board chair, sat at the center, a formidable woman in her 60s who'd built her reputation on protecting patients from overzealous doctors. To her right sat Dr. Chen, who'd recused himself from voting due to his relationship with Maya, but attended as a medical advisor. The other 5 members represented various specialties: oncology, infectious disease, medical ethics, surgery, and psychiatry. And in the corner, barely visible but unmistakably present, sat Carmen Santana, Diego's mother, who'd arrived from Barcelona at 3 a.m. and refused to leave her son's bedside until Maya had personally asked her to attend this meeting. Dr. Rodriguez, Dr. Warren began, her voice cool and professional. You've requested emergency approval for compassionate use of an experimental gene therapy. The board has reviewed your preliminary materials. You have 30 minutes to make your case. Maya took a deep breath, clicked to her first slide, and began. Diego Santana is 32 years old. 12 days ago, he survived a cardiac arrest that left him clinically dead for 23 minutes. We discovered he has a CACNA1C gene mutation causing progressive coronary artery spasms. Despite maximum medical therapy, he suffered a second cardiac arrest 6 days ago and has been on ECMO life support ever since. She clicked to the next slide, Diego's genetic panel, the mutation highlighted in red. This mutation is progressive and ultimately fatal. Conventional treatment only manages symptoms, it doesn't address the underlying cause. Heart transplant is his only current option, but his rare blood type, AB negative, and deteriorating condition make him a poor candidate. Current wait time for a compatible donor in his condition category averages 8 to 14 months. Diego has perhaps 2 weeks before ECMO-related complications make transplant impossible. So he's dying, Dr. Warren said bluntly. We understand that, Dr. Rodriguez. What we need to understand is why an untested, unapproved gene therapy is preferable to palliative care. Maya felt anger flash through her, but controlled it. Because Diego Santana doesn't need palliative care, he needs a cure. And this therapy, she clicked to Dr. Tanaka's research, offers exactly that. For the next 20 minutes, Maya walked the board through the science. She explained how the modified virus delivered corrected genes to cardiac muscle cells. She showed them Dr. Tanaka's success rates, her patient outcomes, her safety data. She presented everything with the precision of a surgeon and the passion of someone fighting for a life that mattered. The therapy has a 73% success rate in initial trials. Yes, there are risks, immune reactions, arrhythmias, potential acceleration of cardiac damage, but the alternative is certain death. Diego is young, otherwise healthy, and has already demonstrated remarkable resilience. If any patient can survive this therapy, it's him. Dr. Samuel Brooks, the medical ethicist, leaned forward. Dr. Rodriguez, your presentation is compelling from a medical standpoint, but I'm troubled by the emotional component. You've spent an unusual amount of time with this patient. You've been at the hospital for 6 consecutive days. Multiple staff members have noted your attachment. Maya's jaw tightened. My dedication to my patient doesn't compromise my medical judgment. Doesn't it? Dr. Brooks's tone wasn't unkind, just probing. You're asking us to approve a therapy that could kill him. That's not the action of a doctor maintaining appropriate boundaries. That's the action of someone who cares too much to let go. You're right, Maya said, surprising everyone in the room. I do care. Diego Santana has reminded me why I became a doctor, not to maintain boundaries or protect myself from pain, but to fight for people when no one else will, to take risks when the reward is a human life. She pulled out Diego's letter, the one she'd carried in her pocket for 6 days, and placed it on the table. Diego wrote this before his second cardiac arrest. He told me not to let fear make my decisions, to fight for him the way I fought in the trauma bay, like his life was worth the risk of my heart breaking. Maya met Dr. Warren's eyes. So yes, I'm emotionally involved. Yes, I care about this patient beyond professional obligation, but that doesn't make my judgment flawed. It makes it human. And Diego Santana deserves a doctor who's willing to be human enough to take this risk with him. The room fell silent. I could see the board members exchanging glances, having silent conversations I couldn't interpret. My heart hammered against my ribs, my entire career balanced on the edge of this decision. Maya called Dr. Tanaka from the hallway, her hands shaking as she dialed. We got approval. The ethics board said yes. Excellent. I can be in New York tomorrow with the therapy. But Dr. Rodriguez, Maya, you understand this is not a guarantee, that even with approval, the odds? I understand. But Diego deserves the chance. When can you be here? I'll take the first flight. Expect me by tomorrow evening. Dr. Tanaka paused. And Maya, I hope your patient knows how lucky he is to have you fighting for him." After hanging up, Maya found Carmen waiting outside Diego's room. The older woman pulled Maya into a fierce embrace. "Thank you," Carmen whispered, "for loving my son enough to save him." "I haven't saved him yet," Maya said, her voice thick with emotion. "Yes, you have. You give him hope. That is everything." Carmen pulled back, studying Maya's face. "You will tell him, when he wakes, that you love him." "I don't know if you will tell him," Carmen said firmly, "because if therapy works, he deserved to know. And if it doesn't," her voice broke, "he deserved to hear it before he go." Maya nodded, unable to speak. She entered Diego's room alone, stood beside his bed, watched the ECMO machine that was keeping him alive. Tomorrow, they would inject modified viruses into his bloodstream, hoping they would find his heart, fix his broken genes, give him a future. It was insane. It was reckless. It was everything Maya had spent 7 years avoiding, and it felt absolutely right. "I got approval," she told Diego's unconscious form. "Dr. Tanaka is coming tomorrow. We're going to try the gene therapy. We're going to fix your heart, Diego. We're going to give you the life you deserve." She took his hand, felt the mechanical pulse sustained by tubes and machines. "And when you wake up, because you are going to wake up, I'm going to tell you something I should have said days ago. Something your mother somehow figured out before I did." Maya leaned close, her lips nearly touching his ear. "I love you, Diego Santana. I love you for showing me how to feel again, for teaching me that caring is worth the risk of breaking, for being brave enough to write me that letter even when you thought you might not survive to see me read it." She straightened, wiping tears from her face. "So you have to live. You have to wake up. Because I spent 7 years building walls and you tore them all down in 12 days. And I need you to be there when I figure out who I am without those walls." The machines beeped their steady rhythm. Diego's chest rose and fell, and Maya sat beside him, holding his hand, waiting for tomorrow. Waiting for the gamble that would either save them both or destroy everything. But for the first time in 7 years, Maya Rodriguez wasn't afraid of the risk, because Diego had taught her the most important lesson of all, that love, messy, terrifying, beautiful love, was always worth fighting for, even when the odds were impossible, especially then. Dr. Yuki Tanaka arrived at New York City Medical Center at 6 p.m. on Tuesday with a small, temperature-controlled case that contained either Diego Santana's salvation or his death sentence. Maya met her at the entrance to the cardiac ICU, her exhaustion evident but her resolve unshakable. "The viral vector is stable for the next 8 hours," Dr. Tanaka said, opening the case to reveal vials of clear liquid that looked deceptively ordinary. "After that, efficacy decreases rapidly. When can we begin?" "Now," Maya said. "Diego's been on ECMO for 7 days. Every hour we wait increases the risk of complications." They gathered in Diego's room. Maya, Dr. Tanaka, Dr. Chen observing, 2 ICU nurses, and Carmen Santana, who'd refused to leave despite Maya's gentle suggestions that she might want to wait outside. The older woman stood in the corner, rosary beads wrapped around her fingers, lips moving in silent prayer. Diego lay unconscious, still deeply sedated, the ECMO machine cycling his blood through its circuits with mechanical precision. He looked peaceful, almost serene, nothing like someone balanced on the razor's edge between life and death. "We'll administer the therapy through his central line," Dr. Tanaka explained. drawing up the first vial with practiced precision. The modified virus will circulate through his bloodstream, targeting cardiac muscle cells. Within 48 hours, we should see the corrected gene beginning to express. Within 72 hours, we'll know if the therapy has succeeded. And the risks during administration? Dr. Chen asked, his role as medical observer requiring he voice the concerns everyone was thinking. Immediate anaphylactic reaction is possible, but unlikely, less than 2%. More concerning is the inflammatory response as his immune system recognizes the viral vector. We could see fever, arrhythmias, rapid deterioration of cardiac function. Dr. Tanaka's expression was grave. The next 72 hours will be critical. If his body rejects the therapy, the inflammation could trigger cascading organ failure. Maya's hand found Diego's, squeezing gently. And if it works? If it works, his heart will begin producing functional calcium channels. The arterial spasms will stop. His own heart rhythm will stabilize. We can wean him from ECMO and sedation. He'll wake up. Dr. Tanaka smiled slightly. He'll live. Then let's give him that chance, Maya said. Dr. Tanaka attached the syringe to Diego's central line, her movements careful and deliberate. Are we ready? Maya looked around the room, at Dr. Chen's concerned face, at Carmen's tear-filled eyes, at the monitors displaying Diego's mechanically sustained vitals. Then she looked at Diego himself, at the man who taught her to hope again. We're ready. Dr. Tanaka pushed the plunger slowly, injecting billions of modified viruses into Diego's bloodstream. The clear liquid disappeared into his central line, beginning its journey toward his heart. For a moment, nothing happened. The monitors continued their steady beeping. The ECMO machine hummed unchanged. Then Diego's body convulsed. He's seizing, Maya shouted, immediately reaching for his head to protect it from injury. Get me lorazepam, 2 milligrams IV push. The nurses moved with practiced efficiency, but Diego's body continued to jerk violently, his back arching off the bed despite the restraints. Alarms shrieked as his blood pressure spiked, 140/95, 160/100, 180/110. This is the anaphylactic reaction, Dr. Tanaka said, her voice calm despite the crisis. His immune system recognizing the viral vector. We need to give him 50 milligrams of diphenhydramine and 125 milligrams of methylprednisolone. We need to suppress the inflammatory response before it kills him. The medications went in. Maya held Diego's head steady, her own heart racing as she watched his face contort with the seizure he couldn't feel. Come on, Diego, fight through it. You've survived worse than this. 30 seconds passed. 45. The seizure began to slow, the violent jerking subsiding into tremors. Then, stillness. Diego's blood pressure started to fall. 180, 170, 150, settling back toward normal. Seizures breaking, Dr. Chen reported. Vitals stabilizing. Maya released a breath she hadn't realized she'd been holding, but her relief was short-lived. On the cardiac monitor, Diego's heart rhythm, which had been mechanically paced by the ECMO, suddenly showed irregular beats, then a run of ventricular tachycardia. His heart's trying to beat on its own, Dr. Tanaka said, leaning forward to study the monitor. But the rhythm is chaotic. The therapy is reaching his cardiac tissue faster than anticipated. Is that good or bad? Carmen asked from the corner, her voice trembling. Both, Dr. Tanaka answered honestly. It means the viral vector is working, reaching his heart muscle, beginning to deliver the corrected genes, but his heart isn't ready. The inflammation is making the electrical system unstable. Diego's heart rate climbed, 140, 160, 180. The rhythm on the monitor deteriorated from organized beats to the erratic squiggle of ventricular fibrillation. He's in V-fib, Maya said, her voice tight with controlled panic. But he's on ECMO, so technically, the machine is oxygenating his blood, so the V-fib isn't immediately lethal, Dr. Chen finished. But we can't leave him in this rhythm. His heart muscle will exhaust itself. Give him amiodarone, Dr. Tanaka ordered, 300 milligrams IE. We need to settle the electrical activity while the gene therapy takes hold. The antiarrhythmic medication went in. Maya watched the monitor like her life depended on it, which, in a way, it did. Because if Diego died, a part of her would die with him, the part she'd just rediscovered after 7 years of numbness. 30 seconds passed, 45. The chaotic rhythm continued. Carmen's prayers grew louder, a rapid stream of Spanish that Maya didn't understand, but felt in her bones. And then, miraculously, the rhythm began to organize. One normal beat, then another, then a short run of 3 before degenerating back to chaos. But it was progress, evidence that somewhere in Diego's damaged heart, cells were responding to the therapy, trying to remember how to beat properly. He's fighting, Maya whispered. His heart is fighting to fix itself. The next 48 hours will tell us if that fight is enough, Dr. Tanaka said. She began setting up continuous monitoring equipment, additional EKG leads, temperature probes, blood pressure lines. Every organ system could be affected as the therapy spreads. We need to watch for kidney failure, liver inflammation, neurological changes, and his heart rhythm will likely remain unstable until the new genes are fully expressed. I'll stay with him, Maya said immediately. Maya, you need rest, Dr. Chen began. I said I'll stay. Maya's tone left no room for argument. I promised him I'd fight for him. I can't do that from home. Dr. Chen sighed, but didn't push further. He knew that look in Maya's eyes, the absolute determination that had made her one of the best cardiologists he'd ever trained. I'll have a cot brought in, an actual food, not vending machine garbage. After Dr. Tanaka left to file her initial report, and Dr. Chen departed to update the hospital administration, Maya found herself alone with Diego and Carmen. The older woman approached the bedside, placing a gentle hand on her son's forehead. When Diego was little boy, Carmen said softly, he was always brave, always wanting to try new things, even when scared. I remember he climbed very tall tree in our garden, get stuck at top, too afraid to come down. I stand at bottom, calling him, Diego, you must try, you must be brave. And he climbed down, even though hands shake, even though he cry. She looked at Maya with eyes full of wisdom and pain. Now my son climb again, bigger tree, taller. And again I say, Diego, you must try, you must be brave. But this time he cannot hear me. So you must say it for me. You must tell him to climb down, to come back to us. Maya's throat tightened. I will, I promise. Carmen squeezed her hand, then quietly left the room, leaving Maya alone with Diego and the machines that were keeping him alive. Maya pulled up her chair, the same chair she'd occupied for days now, and took Diego's hand. Your mother told me to tell you something. She said to be brave, to climb down from the tall tree, to come back to us. Maya's voice broke slightly. But I think you already know that. I think somewhere, even in the sedation, you can hear me, and you're fighting. She leaned forward, resting her forehead against their joined hands. The therapy is in you now, Diego. Billions of tiny soldiers trying to fix what's broken in your heart. It's going to be rough, Dr. Tanaka warned me. Your body's going to fight the treatment even as it fights to survive. You're going to experience fevers, arrhythmias, pain your sedation might not fully block. Maya lifted her head, looking at his peaceful face. But here's what I need you to know. You're not fighting alone. I'm here. Your mother is here. Dr. Tanaka is monitoring every moment, and we're all pulling for you. willing those corrected genes to take hold, begging your heart to remember how to beat properly. The monitors showed Diego's heart rhythm wavering, moments of normalcy followed by runs of irregular beats. It was like watching someone learn to walk, stumbling, falling, but slowly, painfully making progress. "I love you," Maya said again, the words easier this time. "I love you, and you need to live. Because I just figured out how to feel again, and I refuse to lose you before we get a chance to see where this goes, before I get to hear you laugh at my terrible coffee, before you get to meet the version of me who isn't terrified of caring." As if in response, Diego's fingers twitched in her hand, such a small movement that Maya almost missed it, but it was there, a flicker of awareness beneath the sedation and medication. A sign that somewhere, deep in his unconscious mind, Diego Santana was still fighting. Maya settled in for the long vigil ahead. 72 hours. That's what Dr. Tanaka had said. 72 hours to know if the therapy would save him or kill him. 72 hours balanced on the razor's edge between hope and devastation. But Maya had lived on that edge before, in the trauma bay, during surgeries, in moments when seconds determined life or death. She knew how to exist in that space of uncertainty, how to hold hope and fear simultaneously. What she'd never done before was exist there while loving someone, while having her own heart at stake alongside her patient's. It was terrifying. It was beautiful. It was everything she'd avoided for 7 years and everything she'd been missing. 72 hours, she whispered to Diego. "We just need to make it 72 hours. And then you wake up and we figure out how to live. Together." The machines beeped their uncertain rhythm. Diego's heart continued its stumbling attempts at normalcy, and Maya Rodriguez sat beside him through the night, holding his hand, keeping vigil, refusing to let go. Because some battles were worth fighting. Some people were worth risking everything for. And Diego Santana had become both, her battle and her reason for fighting it. The razor's edge was sharp. The fall on either side was long. But Maya had finally learned that the only real failure was refusing to step onto that edge at all. So she stayed, and she waited, and she hoped. For 72 hours that would determine not just Diego's future, but hers as well. Hour 68. Maya had stopped sleeping entirely, surviving on cat naps that lasted minutes rather than hours. She'd watched Diego's temperature spike to 103, watched his heart rhythm deteriorate and rebuild a dozen times, watched every organ system teeter on the edge of failure before somehow stabilizing. Dr. Tanaka checked in every 6 hours, reviewing labs and making minute adjustments to medications. "His inflammatory markers are trending downward," she'd said during the 4 a.m. check. "The gene expression is beginning to show in his cardiac tissue samples. If he can just hold on another day." But it was hour 71 when everything changed. Maya was dozing in her chair, Diego's hands still clasped in hers, when she felt it, the slightest squeeze of his fingers. Her eyes flew open. On the monitor, Diego's heart rhythm had settled into something she hadn't seen in days, a normal sinus rhythm, steady, regular, strong. "Diego?" Maya leaned forward, her voice urgent. "Can you hear me? Squeeze my hand if you can hear me." Another squeeze, stronger this time. Then, slowly, his eyelids began to flutter. Maya's heart hammered as she watched him fight his way toward consciousness, dragging himself up from the sedation that had kept him under for 8 days. "I need Dr. Chen," Maya called to the nurse outside. "And get Dr. Tanaka on the phone. He's waking up." Diego's eyes opened, those hazel eyes that Maya had memorized, that had haunted her dreams. They were unfocused at first, confused, trying to make sense of the tubes and machines and the woman holding his hand like a lifeline. "Hey," Maya said softly. tears streaming down her face before she could stop them. "Welcome back." Diego's lips moved, but no sound came out. The breathing tube was still in place, preventing speech. Maya could see the panic beginning to build in his eyes as awareness returned, the confusion of not knowing where he was, how much time had passed, what had happened. "You're okay," Maya said quickly, squeezing his hand. "You're in the hospital. You've been unconscious for 8 days. We did the gene therapy, the experimental treatment. It worked, Diego. Your heart is beating on its own, strong and steady and exactly like it should." The panic in Diego's eyes faded, replaced by something else: relief, gratitude, and an intensity that Maya's breath catch. His hand squeezed hers again, and she understood the question he couldn't ask. "Your mother is here. She's been here every day. I'll get her in a minute, but first, I need to tell you something. Something I should have said before the therapy, but I was too afraid." Diego's eyes were locked on her face, completely focused despite the medications still in his system. "I love you," Maya said, the words tumbling out in a rush. "I love you, Diego Santana. I love your courage and your optimism and the way you see through every wall I've built. I love that you made me feel again after 7 years of numbness. I love that you fought so hard to come back to us, to me." She laughed through her tears. "Your mother was right. She told me I loved you before I'd admitted it to myself. Said she could see it in the way I fought for you. And she was right. I do love you. And I needed you to know that. Because—" Diego's free hand moved, shakily, to touch her face. His fingers traced the path of her tears, and even through the breathing tube, even through the sedation, Maya could see his response in his eyes. "I love you too." Dr. Chen burst through the door, followed moments later by Dr. Tanaka via video call on a tablet that a nurse held up. They performed rapid assessments: neurological function, motor responses, cognitive awareness. Every test came back better than anyone had dared hope. "His heart rhythm is perfect," Dr. Tanaka said from Tokyo, her voice filled with wonder. "The corrected genes have fully expressed. The calcium channels are functioning normally. This is exactly what we hoped for, better than we hoped for." "Can we extubate him?" Maya asked, never taking her eyes off Diego's face. "His oxygen saturation is excellent. His respiratory drive is strong. Yes, I think we can," Dr. Chen said. "Diego, I'm going to remove the breathing tube. It's going to be uncomfortable for a few seconds, but then you'll be able to breathe on your own. On three. 1, 2. The tube came out. Diego coughed violently, his face contorting, but then he was breathing, deep, rasping breaths that were entirely his own. Maya held his hand through it, murmuring encouragement until the coughing subsided and Diego's breathing settled into a rhythm that was rough, but improving with each inhale. "Water," he croaked, his voice barely audible. Maya helped him sip from a cup, supporting his head gently. When he'd had enough, he looked at her with clear, aware eyes and said the first words he'd spoken in 8 days. "You saved me. Again." "We saved each other, Diego," Maya corrected, her voice thick with emotion. "You saved me first, Diego. You taught me to feel, how to hope, how to fight for something beyond my career." "I heard you," he whispered. "All those days, your voice, telling me to fight, telling me to come back, telling me you loved me. I do love you, so much that it terrifies me." Diego managed a weak smile. "Good. Terrified is better than numb." Carmen rushed into the room when called by a nurse. She hugged her son as much as the ECMO lines allowed and spoke in her native Spanish, crying so hard she couldn't control her emotions. Diego responded in the same language, his voice growing stronger with every word. Maya stepped back to make room for them, but Diego reached out, took Maya's hand, and pulled her back. "Don't go," he said in English. "Please, I need you. I need you here. Don't deprive me of you right now." Realizing she had no other choice while experiencing what was happening, Maya stayed, becoming part of the reunion, the family, Diego's new beginning. Standing there, holding the hand of the man she loved, watching her mother and son embrace, Maya realized something profound. She had spent 7 years building walls to protect herself from loss, but those walls had also shielded her from love, from bonds, from the things that made life worth living. Perhaps in protecting her, life hadn't been very generous to her in that sense. Diego hadn't just rescued her from her safe castle. He had shown her the risk of loving someone, the fragility, the possibility of heartbreak was worth it. Because this moment, this impossible moment she watched as she came alive, awake and healing, was worth every fearful second that had come before it. 3 months later, the coffee shop where Diego had collapsed looked different in autumn sunlight. Maya stood outside, staring at the door, Diego beside her, holding her hand. "You don't have to go in," Diego said gently. "We can go somewhere else." "No," said Maya. "I need to do this. Need to replace the memory of the worst day with something better." They entered together. Diego ordered his usual espresso. Maya ordered tea. They sat at a table near the window, not the one where Diego had fallen, but close enough. 3 months, Diego said, smiling at her over his cup. 3 months since I died, and look at us, having coffee like normal people. You were never normal, Maya teased, even before the cardiac arrest. Fair point. Diego's hand found hers across the table. My doctor says I'm doing remarkably well. Something about gene therapy success beyond anyone's expectations. Says I might even be able to run again. Maybe do another marathon. Your doctor says you should start with 5-kilometer walks and see how your heart responds. Don't make me regret giving you such an optimistic prognosis. My doctor also said she loves me, Diego said, his voice dropping to something intimate. That was my favorite prognosis. Maya felt warmth spread through her chest, still strange after so many years of emotional numbness, but increasingly familiar. Your doctor is still getting used to being someone who says things like that. The doctor is doing a truly amazing job, Diego squeezed her hand. More than amazing, he's learning to take a break. He's finally starting to realize that everything has its time, to leave the hospital before midnight, to choose to truly live rather than just exist. This was true. In these 3 months, Maya had changed more than she had in 7 years, becoming a completely different person. She reduced her working hours, began to see her patients as people rather than puzzles, and even started going to dinner parties at her colleagues' homes. She seemed to have become an emotional person who lived her dreams. She learned to balance her commitment to medicine with her commitment to Diego, to herself, and to the future they were building together. I'm thinking of writing an article about your cases, about the success of gene therapy. Dr. Tanaka wants to be a co-author. It could help other patients with calcium channel mutations. Will you write about us too? Will you write about the part where you fell in love with me? Diego asked with a smile. This isn't a medical issue. It's not related to science. Medically, this is the most relevant part. It shows that doctors are human too. They have feelings and emotions. I think that's the most accurate description. It shows that valuing patients doesn't weaken your judgment, but rather strengthens it. Maya thought about this, then smiled. Maybe I will mention it in the acknowledgement section. Special thanks to the patient who taught the doctor how to feel. I like that. But I think you should also add this, and to the doctor who wouldn't let the patient die even if it meant putting the patient's heart at risk. They finished their coffee in comfortable silence, watching New York rush by over the window. The city where they'd met, where Diego had died and been reborn, where Maya had learned to tear down her fortress and build something better in its place. I have something for you, Diego said, pulling a small box from his pocket. Maya's breath caught. Surely it was too soon. They'd only known each other 3 months, only been officially dating for 2. But Diego opened the box to reveal not a ring, but a small silver pendant shaped like a heartbeat. It's the rhythm from my first EKG after the gene therapy, when my heart started beating properly again. I had it made into jewelry. Thought you might like a reminder that miracles happen, that impossible things become possible when someone refuses to give up. Maya's eyes filled with tears as Diego fastened the pendant around her neck. It's perfect. Like you. Like us. And as they left the coffee shop together, stepping out into the autumn afternoon, Maya knew that Diego was right. They weren't perfect. They were both damaged, both healing, both learning how to live without the walls they'd built. But they were perfect for each other. The woman who'd forgotten how to feel, and the man who refused to let her stay numb. The doctor who saved a life, and the patient who saved her back. Two people who'd found each other on the worst day imaginable and turned it into the beginning of something beautiful. Between heartbeats, Maya learned the most important lesson of all, that love, terrifying, vulnerable, impossible love, was the greatest risk worth taking and the greatest reward for being brave enough to try.